It's Tuesday morning, it's buyout, the trailer's already backed up, horses are already unloaded. It's time to get jumping right into this rescue mission. We're saving a lot of lives today. So let's catch up with the vet team. Let's see how many horses are we gonna save today. And I'm telling you what, it's only because of your donation that we're able to save these horses. So if you haven't donated yet, I would like to urge you, just please donate $5, $10, $20. It all adds up, it all helps a lot. So let's go see the horses.
This guy is only 8 years old. He's a stallion, and he's basically non-weight bearing lame on this right hind leg. He's got a big wound here that looks old, and then this area looks active. You can kind of smell it. So I gave him pain meds right away before we even brought him in. I just gave him a sedative so we can get x-rays of that leg, but I am very, very concerned. His resting heart rate was 67, so he was definitely painful. His respiratory rate is elevated, and he has a little bit of nasal discharge, so I'm gonna culture him too.
This poor guy is just so sad what these horses' conditions is when they come in sometimes. Like, oh, horrible, just horrible. So we've got little horses. I realize this is the first you're seeing these horses. I wasn't actually able to get up here to video the unloading process because I was stuck in a meeting that I had to be in. But I'm here now, and these are all the little horses. I know you'd rather see them than me. It's a lot of horses.
You want to give it a halter?
That would be wonderful.
Dr. Lydia, how many horses came off the trailer?
I have no idea.
Oh, okay.
I wasn't actually here for either of the trailer unloads. Vince says 24.
25. Okay. Wonderful. 25 horses saved today.
And I'm just looking to see who seems to be in the most acute. Okay. I see that. Don't touch the foam.
Will not touch the phone.
Hi, you're okay. I'm sorry, we're just checking this in here. Okay. Whatever works best for you, I'm fine with. He is sedated, so shorter distance is going to be easier for you. Sydney, you could try going out here and just walk down this aisleway. Yes.
So this poor horse is so skinny.
Yes. If we're going to end
like unbelievably skinny.
waiting, I think microchips.
You can just see the bone is not supposed to be sticking up that far above him, and the shelf and spine is just sticking out. So sad.
And the smell is this poor horse. And we still have shoes on, so someone was still making this horse work. Ooh, do you smell? You guys, this is a stallion, so we do need to make sure that we don't put any mares out with him.
Look at this poor leg when he moves forward.
Hi, sweet thing. I'm so sorry.
Oh, so bad.
I'm a treat giver.
Me too.
So what are you hearing in there?
I think this is a mitral valve regurg. You wanna?
Sure, I can listen.
It's systolic.
You also have no eyelids.
It almost looks like he's had a lid resection on the left. I think it is. I haven't examined the right eye yet.
Did you have this?
This is a mare.
Ma'am, did you have squamous?
I'll get out of your way.
No, you're fine.
Look, she's trying hard to move in.
Yeah.
Ma'am.
It's poor mare. What would you body score her at, Dr. Lydia?
Probably a 1. Yeah. The winter hair coat adds a good bit of fluff, but I mean, you can feel her complete scapular spine and her pelvis in front and behind. Hi, Mama. Okay, see how, do we have fluorescein stain up here?
Yes.
She's got an ulcer, super bad ulcer.
Oh, yeah.
Yeah. Do we have Preparacaine up here?
No.
My big girl.
Yeah, actually, Nicole was taking. I did pictures of the first two.
I know, Mama, this hurts. I'm so sorry.
Same.
We have a up-down.
Sure. I'm gonna let that.
So what in the world did you
Kick
put in
in
that horse's
first.
eye?
So I numbed the eye. This horse has had systemic anti-inflammatory pain medication. I've numbed the eye, and she's still squinting it. She has a melting bismetacele, which is a fancy way of describing a corneal ulcer that's gotten so severe that it makes the whole cornea absorb fluid. The cornea should be impervious to liquid. I know, honey. And you can see the stain uptake. This mare also has signs consistent with squamous cell carcinoma. Oh my goodness, look at see the blood pooling at the bottom? So that ulcer's been there a really, really long time. Yeah.
Oh, wow.
And her body has tried really, really hard to heal that ulcer. And she's not visual, but she's also very, very painful. So this probably is squamous cell carcinoma and then secondary exposure keratitis.
Like it looks like she's had
But where's
lid resections.
the smell is so, and do you want to go look at these other horses? I'm going to go walk down here.
Now she's going to go down and get some x-rays. See how she's doing. I think that's where they're going. Pretty sure.
So today I'm helping Dr. Gina out with the radiographs, and this mare right here, I think we're doing her face. She stinks, so she's got some probably sinus problems, and her eye right here, she's got some issues, and she's super sweet, so it's kind of sad, but we'll see if we can figure out what's up with her.
Did anyone age her yet?
I think,
26.
yeah, like mid to upper 20s. She's an old girl. Yeah.
I'm gonna try with her sinuses.
Fun fact.
Up a little bit closer to your eye.
Horses have very heavy heads.
There's a lot going on. Oh, man.
Do you have a training program that doesn't kick in until they're out of quarantine? Could be a dental abscess.
There.
Yeah, she's got opacity up there, and I got her all pouch. Oh, I'm sorry.
you're fine.
Snagging you.
So,
Yeah. So our gum line is she's worn to the gums. I age her at 26, but if you think that she's a different age based on those rats, just let me know.
And today Justin is teaching Liz how to take Coggins photos. This horse has some hay on the back. How cool. That means some horses were eating. Yeah, so Liz recently joined our team, and she's going to be very busy. She's promotes things. So anyway, today she's learning Coggins photos, and Justin's teaching her well. And the horses are all being seen by the veterinarian. Vince is down here taking photos. These photos are actually very important also. The world does not just revolve around video. And everyone's just super busy outside while the vet team is busy inside.
Sorry, we're just trying to snag anybody that looks really, really painful.
Somebody already took these photos for that horse, I believe. Maybe not.
I did not, so unless
BPT2 is already filled.
All right, this is the next horse.
BPT2 is not shown anymore. So we can
Was there anything you initially saw in this horse? What do you want to do next?
This horse looks like she has a failure of part or all of the soft tissue apparatus in this left front. When she walks, her heel flops down and her toe comes up off the ground. It actually looks like somebody trimmed her somewhat recently. You can see chunks of her feet coming off, but we're gonna take radiographs of this leg. But she looked so painful trying to walk that she hasn't been sedated. We just gave her pain medication, and I'm gonna make sure her heart rates come down a little bit before we move her in to take x-rays.
So this is that paint mare that we just looked at, the 26-year-old that has the odor, and the foul odor is definitely coming from her teeth. It's hard to take individual parts of the mandible, but she looks like she's missing a tooth and the other tooth is abscessed. And also this one up here looks like it's also about to fall out. So I think she's got a pretty bad dental disease abscess going on.
I think we need to bring her this way. Do you want to just carefully take a couple steps and see if she's a little bit more comfortable walking? Her heart rate's still pretty high. Oh, honey.
I guess we can also try to start.
Just take it really slow. Yeah, she seems much more comfortable. See how when she steps, her leg kind of flops up for a second?
Nobody can go in the round pen with that stallion.
So this horse is also getting x-rays. See what's going on with that front leg.
This mare, when you watch her walk, she never puts her toe down. When she puts her heel down, her toe actually comes up. So in horse legs, and ours too, you have extensors and flexors. And so when this happens, there's a failure on the back and the extensors are pulling harder than the flexors, so her toe is coming up. Good job, Mari. Well, so I was just doing a complete of the fetlock because I know that's what she wanted, but yeah. So if you look at this view of her foot, you can see that the bony column inside the hoof is totally rotated. Like the hoof is growing in a different direction than the foot's inside the capsule. So, interesting findings, but yeah. Not great, ma'am.
Front heel and inside and front of half pastern white.
So the right front does have white.
Yep.
So Dr. Lydia found her.
Yep, it matches.
She's
Bay
branded.
mare.
How old was she again?
She's 25 years old, and her registered name was Super Smokin', but she has a prior name as This One's for Joey.
So is it body clip or is it just hair falling out?
It's hard to say.
No, I'm not gonna.
It could be pruritus. See, all the areas are consistent with like turning around and biting.
Cute little pony. Got some hair problems.
It's possible. Good job, Mama. You're all right.
How do horses?
Nicole, I highly suspect that we may have Cushing's disease.
Lynn is running
She's
for
just
some
really,
reason.
really dehydrated.
What you need? What happened?
She just wrecked.
Who?
Emily. She's okay. She just got past the S curve and she ended up hitting a tree. Hey, Justin, are you able to go?
Yeah, I can go. Where is it?
She just got past the S curve, so she's probably still on the road.
Is she leaving?
Yeah. But she,
So Emily wrecked. What? I'm just.
no, she said a wasp had got in the car. She was trying to swat it, and she said she closed her eyes for a second and went right into a tree.
Oh no. Emily, what?
She's okay. The truck is not okay. The truck is not okay.
Is someone with her?
I'm sending Justin to go down there with her now. Because Keith, I tried to call him because he went to go get the pizza. So he'll probably meet her coming back. But I couldn't get in touch.
Can we get in touch with Jordan? Like even if she's
Yeah.
maybe okay, she probably needs to
Yeah.
be checked out and have somebody be with her.
Yeah.
I don't have Jordan.
Do you have a liver problem? Or do you get into some toxicities?
Yeah, right? I mean, that skin, she's got hair coming in underneath it, but that's chunks of epidermis.
And then
I'm not gonna
So
hurt
how old?
you. You good
I wonder
girl.
is she?
You good girl. Okay. So Galvani's groove is no longer present on this side, which would put her past 30. That's okay. I know, Mama. I'm sorry.
oh goodness.
She's at least 30. You're a good girl. Can you see?
At least 30.
Oh yeah, you got hardly any teeth back there. Why am I so bad at this? I get it wrong every time.
Oh, you do this at top backwards?
Every time. I know, Mama, I'm not gonna poke you again.
So what is
Every
Dr.
time.
Lydia
I
doing wrong?
But like I turned it around and it's still backwards. So like how is that?
Be like that.
She's trying to put the tag
It's still
in.
backwards.
No, that's how it goes. Clip it through.
No, I'm talking about this thing
the
being
tag.
visible.
So it'll have to go on through like that.
I know, but every time I do it, it's wrong. Here, you do it. Underqualified tagger. Hi. Hi, guys. Do you want a treat? Hi. You gonna get pushed off? Look. Ooh. Oh, don't kick me. That's a very good citizen, thank you. Hi. You vision impaired? You want a treat? Can I tell her what she's gonna do? She'll give you treats. That's a good job. Oh, you baby. 3. Don't get attached. Look at these legs.
I know, and that was gorgeous too.
Look at this. Okay. You all right?
Just a little baby. That's big. It's got bad legs, so we'll see. See what the diagnostic
Good job,
shows.
sweet thing. It's a beautiful horse. I know. You're okay. Yeah, we're only 3. See how it's popping out? This reminds me of that Palomino we had. Okay. Yes, please. Both carpi are effusive. Carpi and fetlocks on both forelimbs. We are very base narrow, like severely, severely base narrow.
Dr. Lydia is actually reaching all the way under the horse and around to listen to
Listen
the
on the
other
right.
side. How did her heart and lungs sound to you?
Ooh, so this little gelding is only 3, and he's lovely, great temperament. I am very concerned that he has a right-sided murmur. 3, this is the 3rd horse this morning that I've looked at that has a murmur. And a right-sided murmur in a young horse is always very concerning. We had a little filly come through our buyout program in February that also had a right-sided murmur, and we just did her cardiac ultrasound and confirmed that she had a ventral septal defect, which is a congenital hole in the heart, basically. I said that wrong, ventricular septal defect, a VSD. This guy also has very swollen, hot carpi. So both of these knees basically are very warm and kind of effusive. But then the fetlock joints in the front and also in the hind don't just knuckle over, they kind of pop forwards when he takes a step, which is not normal. So I think, and then we also are very, very base narrow. If you look at this horse, his shoulders are super narrow and his legs kind of go out like this. So this looks to me like very poor breeding and multiple congenital issues. And you're such a good boy.
And now Dr. Jean is listening to the heart murmur while Nicole is drawing blood.
Hi, sir. Can I look at your mouth one more time?
I got a needle in his throat.
You're a good boy. Oh, wait. Sorry. Thank you very much. Oh, you're very good boy.
And he's very sedated, so that's why he's walking a little crooked and kind of looks drunk.
Ooh,
But I can't tell without.
he sure does. It's a fracture. Look, there's, I don't know how I messed that up so badly. There's a fracture in this carpal bone.
I wonder if someone tried to race him and he
Right
fell.
there.
Or it could be a stress fracture.
You see that? Yeah. Poor buddy.
The other side.
Yep, right part. got weird spacing in your joints, sir.
Yeah, this up here was my giant finger.
Yeah,
up there.
Yeah.
And what's going on?
Yeah. And for a baby, he's very well behaved.
I wonder if we can get flex.
3 years old.
A little blurry, but yeah.
What's that?
Look on this side. Looks like that, and then looks like there's another little spot up there. Yeah, and then up there at the breastplate.
In the middle.
Yep.
And then there's
Joint collapse. The soft tissue structures that are supposed to be holding the leg in a normal position aren't doing their jobs. You can see in both of those fetlocks that are just kind of like knuckled over. But this horse also had to have undergone some kind of trauma because he has a broken carpal bone in his left carpus and evidence of a lot of trauma also in the right carpus. And both of those knees are really warm and swollen. Poor buddy. Don't get attached. We have yet to have...
Before you touch that horse, these pictures.
Okay.
and then you could go to some skiing all in one day.
Who is taking pictures? Okay.
All right, so we're on gray.
Okay, Liz, I've been told I can't touch the horse until you have the pictures. So, let's get them.
I ain't got no more.
Okay?
Just to show you what the paperwork.
Okay, I can delegate this. Here you go, Nicole.
You could be like, you could pass for like looking like a biker, but.
Oh, hi. Are you her situate?
They got to do pictures.
Totally agree. Getting the next horse in and getting pictures is great.
So do I need to get another horse, get Amber out here?
No, you can stay here for right now. I mean,
Yeah, you stay if somebody else wants to find her.
What does a locked mandible mean when you get a second?
I will show you. I'm gonna poke you, okay?
Yeah, she had one out there.
Oh, that older pony, she's very needle phobic.
I'm gonna try to euthanize her before I leave, and that.
Okay, well, I also do not mind doing it. So a locked mandible, I should be able to, and obviously I'm being very gentle, I should be able to hold the maxilla and the mandible, the top and bottom, and move the jaw from side to side. And you see when I do that with this horse, we have absolutely no movement. He also didn't or couldn't take treat, so I definitely suspect we have some major dental pathology going on. And obviously I'm not like jerking on the jaw I'll show you in another animal. Normally those joints move very freely and without pain. You are very, very thin.
I don't like it when Dr. Lydia says, well,
Oh, this is just an unexpectedly really high heart rate. So even though I don't have any obvious indications that this horse is painful, I'm gonna give pain medications based on that heart rate, which was 88.
Ooh, that is
Yeah.
high.
A purple top
Yep.
would be great. Nobody wants hair in your eye.
Would you like 10?
Let's go with 9. And a cataract. Oh boy. It's really interesting dental pigment.
Need to brush your teeth more often.
Yeah.
Been chewing on coffee or something. I don't know what's going on there.
There are several equine orthodontic conditions that can cause changes in enamel color. Let's say we're like 22, 23. Can I look in your mouth? I know, okay. The back teeth also have a similar pigment. Okay, thank you. Let's go ahead and microchip her. She is one that I think,
Scan her first.
Yeah.
Probably got to get better about scanning everybody. 'Cause
good job. She has metabolic disease. So her situism means very, very hairy and not shedding. This time of year, it's really hard to tell. If this was July and this horse had this hair coat, we pretty much could diagnose them with Cushing's disease. So you shouldn't normally palpate any heartbeat in a foot. And if you feel kind of towards the back, right there, it's akin to feeling somebody's wrist, only in a human wrist you can palpate a pulse normally. This one is not a great learning case because it's very, very faint. But let's add foot rads too. Hi. Why is your neck clipped? Hi. You're all right? You're super worried about it? It's okay.
A little bit of a worried eye there.
You want some treats?
Let's hold off on the treats just for a second.
I'm very sure right there's him.
That could have been like a vet pulling blood, but very few vets I know pull that high up. And this feels like maybe someone gave vaccines and clipped on the side of a neck. I mean, that's the injection triangle, but.
Would you say under that head there's white?
Yes.
He just looks so worried. Like, his ears are back. A bit scared looking.
I know, it's very, very rude. So see how Galvani's groove, feel the top of that tooth, feel how smooth it is at the top? And see how it's smooth until about a third of the way down?
Yeah, about right here.
So Galvani's groove is all the way to the bottom at 20, but as it starts coming out at the top, this would be like 21, 22, 23. We're like 23-ish, maybe, but could look totally different on the other side, right? So sometimes, yeah, see, like this tooth is smoother much further down. So I would bump her to, I think she could still be 25.
25?
Yeah. And the rest of her teeth feel to be in pretty good shape. And her body condition score is not awful. It's not great, but it's not awful, right? So age is just a number. I wouldn't ever euthanize a horse just because of their age. Good girl.
In this exam.
Can you do it one more time for me? Okay, and then back is great. Good girl. It's a very good girl. It's a very good girl. Yeah, there's not a lot you can tell just from a really short walk, but if you're very, very lame, I wouldn't call this a lameness exam. I would just call this like a quick once over
Right.
day.
Okay. Like, do you want vaccines for this horse?
Yeah, let's vaccinate her.
All three?
Yeah, let's do all three. What do we want to call this little mare? She's not gated, and she does already have a microchip.
She is already microchipped.
So totally a theory, but it almost looks like someone clipped here to give vaccines. I wish I knew that you already had them. Good girl. I'm gonna give both of these in the left neck.
Okay.
You're a good girl. Very good girl.
Do you want the warmer?
Yeah, let's do it. 608. Let's see if we can find her. Do you want to look something up for me? Will you see if you can find Avid microchip? Here's the number. Hi, sir. Is that hyphema in your eye?
It is.
Super dehydrated, huh? I'm gonna take like 2 steps forward so we're not in her way. Perfect, thank you.
So this sweet boy is being evaluated by Dr. Lydia.
He's gonna need a cardiac ultrasound.
Gonna need a cardiac ultrasound. I don't think Dr. Gina's gotten the ultrasound out today, so she'll be checking him out.
So we have a little bit of movement, but not all the way. Did someone beat you up? And he is maybe 22. You look older than your teeth say you are.
Oh, yeah.
So see how at the top it's smooth, but Galvani's groove comes to right about here. So halfway down would be about 25, so I would say we're like 22.
Oh, okay.
I know it sounds dumb, but like, I don't feel like I can really evaluate legs packed in that much filth. I don't know if we could put him down to have his legs washed before we do his ultrasound so we can actually evaluate those too.
I mean, if we're just bringing him in, then we can.
Yeah, let's make sure we document that though so it gets done.
Pretty much treat powder. It's like, treat powder. Treat powder is not the best, but it's better than nothing. So if y'all want to donate some treats for the horses, that'd be great.
My favorite treats are the German horse nuggets, which are the big, delicious, like, they love them. And they're really good for hiding pain meds in. The German horse nuggets are.
German horse nuggets.
Not the trash.
Oh, he's so hungry, he's scrounging for the goodies. You're such a good boy.
Wait, you want me to lead him back out
You're
that
a good boy. So the mare that we just vaccinated and microchipped, you could put him with her.
Okay.
I think,
Take him back out the way he came in. If it's...
sure. I think body condition score wise, we shouldn't green him for a couple days, but he probably is gonna need to be on green. That right front. Thank you so much. Something is going on. You want to just stop right there? We don't know what any of these horses have. Yeah, she's a girl. Did you have a wart on your nose?
Right there?
Yeah,
Oh,
maybe. Maybe. Good girl. She's a very good girl. You got pain on in your pole?
I usually go back and check.
Okay. Okay. Good girl. Good girl. Good job. Okay. You can see the cutaneous trunci response right here. That's a indicator of discomfort. I'm just, okay. Very gently palpating right there.
You look scared to death.
You're okay.
Okay.
I like it so much better when I can see your eyes and you can see mine. Yeah, I feel like we can talk better.
Anything popping out at you?
Yeah, this mare's whole leg is very much out of alignment. Her feet are super overgrown, so her medial to lateral balance is very off. But when she's walking, her right leg is really turned out, and she's putting her weight on the outside of her foot first and then the inside. But the outside is actually shorter than the inside, so there's a lot going on in this leg. And it may originate higher than the carpus. She's got some discomfort in there, but her heart rate is normal. I almost wonder if it might be this elbow. Is that hurt right there? Hi, can I please look in your mouth? You're a good girl. You're not that old. You see the other side? I know, you're a good girl. She also has pain on palpation of her pole. 16? If you watch her walk, the right front, she lands medial and then lateral. This leg is very abnormal. And it almost crosses over in the front. But like diagnostically, I don't know that we're gonna see how she crosses all the way over? I almost feel like it's much higher up in the leg. She doesn't like palpation of her shoulder. Yeah.
Alrighty, this is the next horse coming in. Beat up, skinny, scrapes, injuries, kick marks, all kinds of stuff.
Hi. I know I look really weird in all my stuff.
brachycephalicus and omotransversarius are very well developed, but not up here. So that means she's chronically gripping and carrying herself in a way that's altered. So if you see all this atrophy up here, she's not engaging her neck and her fore limbs like she's supposed to. She's mainly gripping up in here. So that's why her neck looks so bulgy down there. Could be from pain, lameness, she's just not engaging her front end like she's supposed to. There's also a dip right here. So if there's a dip right in front of the withers, that also means her head carriage she's not carrying it like she's supposed to. You're painful somewhere. You got so much atrophy, you poor thing. Triceps brachii, your biceps brachii, and your gluteals.
You so sweet, big girl.
Is that scary?
What do you hear?
If you listen to her, I'm going to try and repeat what it sounds like. It's like, boo up, boo up. That's what it sounds like.
I mean, if we have papers, would then microchip?
We haven't aged him yet because I haven't put gloves on to look in his mouth, but he's got really crusty, mucopurulent, and spissated type of nasal discharge. He's also got ocular discharge. He looks like he doesn't feel very good. When I listen to his lungs, I can't hear anything on the right side, so either he doesn't have infection on the right side or it's consolidated. I did hear some cranioventral sounds on the left, and he has a pretty significant heart murmur that you can hear on both sides, left and right. It's louder on the left. So I think it's primarily a left-sided problem. He's got a lot of atrophy, and he just doesn't seem like he feels very good.
I know. He's just looking at your tooth. Look on his lens. He's got little punctate cataracts
Yeah.
all over the place.
He also has some pigmentation in it.
See him? See on the lens itself, there's all the little white. And then he's got some pigmented strands, looks like kind of coming out from the iris. Can I see it? Will you just have that ready for me? Yeah. No, easy, easy. Oh boy. Yeah.
Try to do it without picking up.
It's an abscess. I kind of want to look at it.
So this horse is going to get a cardiac ultrasound because he's got a very, very unique heart sound.
Blood pressure is pretty high. Okay. Because I also experience
So this horse has a little problem down here on this hoof, and yeah, it's just not good at all. So gonna see what's going on with that, get a cardiac ultrasound. This horse needs a lot.
1 second.
Dr. Lydia is looking for little infections that she can spray.
Come on. I know, big boy. Come on. Good boy. Here we go. See where the snot, yeah, there's the snots. I'm not as worried about the blood as I am about the nasal discharge. Okay.
Oh, it's a big draft horse.
Look at you, handsome.
Looks like there's something up right here.
Hi.
And I'm just curious what that is.
Hi. We will definitely look.
Okay.
We are vision impaired in both eyes. Visual but impaired. What happened to you, huh?
See his stomach? What is that? I guess you have to have an ultrasound to really know.
We have an ultrasound.
So then, do you want to grab, one of you grab the next person for them?
Yeah, big boy.
Hi.
Poor dog.
Hi. So this horse is pretty significantly vision impaired, you guys. Just be aware. Like visual, but barely. And we're in our 30s. Okay. Okay. Okay.
Oh, wow.
So see, there's no Galvani's groove anymore. Okay. So let's.
Poor old horse.
Mid 30s. Draft. I would call this.
I'm going to say 35.
This is a mare. Okay. Looks like we have chronic diarrhea.
What do I put for color?
Chestnut. Girl. Will you let me look in your mouth? Can I look at your teeth?
I don't think she can see very well out of that eye.
No, she's got vision impairment in both eyes. Can I hand you this, or maybe you, if she opens her mouth at all? Hi, Mama. I'm just gonna look, okay? You're a good girl. You're a good girl. I know, it's so rude. Okay, we got a little bit to work with on that side. Put this one. You okay? You okay? Ooh, we got some sharp points. Okay, you're a good girl. Good job. Thank you, sorry.
Let's see if I can get a good view of it for you. So that's the left side of his heart that we're seeing for the most part. So there's hypertrophy or increase of the muscles that surround it. I kind of keep losing contact, but. And then I had it on for the murmur part, just I can try and do. And that's the murmur in visual form. I keep losing contact because he keeps pushing his elbow back, but.
You want me to pull it like?
It's okay. So I was about to move to the right side because then I can see if we pull his right foot forward, I can get a really good view of the heart.
Definitely washing.
There, so this is the left side of the heart. You see how thick that muscle is? And when it contracts, it doesn't contract all the way down, and there's the right side of the heart. Let's see if I can. All heart valves.
Oh, wobbly.
Yeah, sorry, Betty. Come back here, Joe. I need you.
Do you see any specific reason for the really weird sound? Or is it just kind of all messed up in there?
Let's see. Let me take it off the color. You might have some valve stenosis. Looks like it doesn't contract super well to close. Ooh, somebody out there is mad.
That bait.
Oh, you mad. And then like, if you look over here, it's kind of hard to see it. When it comes in the view, it's kind of floppy. But this valve is the one I'm really looking at. It kind of sticks and doesn't close all the way. So I think that's the murmur.
So what did you think on the draft?
This draft mare is quite elderly. She's in her mid-30s, but she has some teeth. She has diarrhea, but she has peristalsis, so her GI tract is moving more quickly than it should. We are getting a sample of that to try to figure out exactly why that's going on. We dewormed her. We're gonna hopefully fix a lot of her problems with her teeth, but she got vaccinated and microchipped, and she's gonna get turned out to decompress. We're also gonna run full blood work on her. But age is just a number, it's not a disease, so I'm hopeful for her. She's very, very thin. We're gonna have to be careful with refeeding her, but I'm hopeful.
So this is the next horse, not trained to lead, so in the chute system. Sadly, looks pretty scared and just trying to figure life out real quick. Just keep going, baby. Just keep going, baby. Oh, it was Haley that was encouraging the horse to back up. So Haley went and busted her arm a few days ago. with horses. So she's, as Tawny said, she can look, but she can't touch.
You can see this is tricuspid valve. This hesitation right there, that sucking, that's the murmur that you're hearing. That's the sucking sound. I'm going to take a video when you're ready. Sure. This is going to make it pause because it's retroactively saving the clip. That's amazing. Well, I should let Dr. Gina talk about it. It's her.
She already did.
Her ultrasound. But it's just nice to see a visual representation of a sound that you hear and confirm.
So the little horsey was backed into the round area here, and Liz is getting the Coggins photos.
Best chance is opening this up anyway.
All right. So this horse is going to go into the squeeze shoe.
Good job, buddy. You okay? You're all right.
So the squeeze chute is so amazing because horses like this that it'd be extremely dangerous for our staff and for us and for the animals. We can put them in here, we can draw their blood, we can give them vaccines, microchip, and whatever we need to do, we can do in this machine safely. And it's all padded for them, so they're perfectly safe and comfortable. It is always tough to get an age on a wild horse.
Okay, all right,
But,
all right.
He's in there.
Good boy. I think we're gonna have to squeeze him a little bit more. Good. Great job, guys. You're okay. You're all right. Are you gonna bite me?
He's trying to take bites at you, Dr. Lydia.
All right. Easy. Oh, no biting. Okay. We don't want to bite the people. All right. This is a mare. I guess we'll have to put her in the chute. That's okay. Come on, big girl.
It's not exactly very interesting to watch a horse be evaluated in the squeeze chute. You can't see much. So next few horses may not be seen a whole lot. This one was definitely a little bit troubled in the chute and trying to nip at people, so we just have to be super careful.
You good girl. Oh, Galvani's groove is almost all the way to the bottom. Let's call her 18.
18 and still that grumpy. Wow.
Yeah.
Do y'all remember the squeaky gates from the auction assessment lives? Like a couple years ago, there was always squeaky gates and we always wanted WD-40. Well, I've got my WD-40 here today. And I have it because some of these were getting hard to use. Where's my camera? Let me spin it around. So, now I have WD-40 them, and they're much easier. Very much easier. So, WD-40. It helps at auctions. It helps at our shelter.
Okay.
It helps everywhere. All right, Liz is trying to get the last angle on this horse.
Did you get it?
Dr. Lydia is going to see if she's also trained.
What do you think, good girl?
This horse was offering to nip and bite at people, so go very slowly, very carefully.
Hey, Mama. Could someone hand me a halter? Here, let's come over here so we're not in bitey range. Thank you. Hi, big girl. You're okay. It's a very stressful day. You're all right. Good girl. Good girl. You're okay. That's good job.
Paper for that one is right here. She's number 64.
64, got it. Should I sing the Beatles song? Will you still need me? You're a good girl. Here we go, Mama. Very good. You're okay. Easy, Big girl. Good girl, very good.
Sometimes with a halter trained horse, you don't know if they're halter trained. I often wonder, are they thinking, why is this human going so slow?
girl.
Don't they know how to halter a horse? And we don't know what they know. So human safety is of absolute utmost
Girl.
importance.
Okay. Can you back up? Good girl. Totally halter trained. So, Liz, I'm gonna get her right back out here and I'll just hold her so you can get that picture. Ooh, good girl. Very good. Good girl.
She can be evaluated for everything.
You're a good girl. Yeah. Okay. Can I see how old you are? Good girl. Yeah, no one likes eye boogers. You're all right. Good girl. Good girl. Good girl. Good girl. Yeah. Maybe 18. You're not super old. You're a very good girl. Good job. Okay. I know. You're doing great. You're a good girl. Good girl. Okay. Good girl. Hey, look at your teeth on this side. You're okay. Good girl. Good girl. She only looks like she's about 16. Not gonna hurt. You're all right. Oh, what about this? It's all right. Good girl. You're so smart, huh?
It's like she wants to be good and then she bites at people.
Yeah. I really enjoy highly intelligent animals. I think they are so easily misunderstood. It's hard to assign intention, but like if something's trying to hurt you, it's easy to get mad at them or take it personally, and you just can't do that with horses. Good girl. No biting. I know you wanted to. Don't do it. Don't do it. Good girl. Good girl. Good job, Mama. Good girl. Good girl, I know. Good girl. Really big one. Oh, this hair. Okay, we just have one more poke and it's on that side. I know. Good girl. Okay. Physically, this mare looks great. Behaviorally, she's not super great, but she is halter trained and showing positive response. But I think I documented. We were just discussing that. This horse is a miniature cow.
I call him Black Top Yana.
Hey, what do you think? Are you a black top? Hi, cutie pie. Let me see your face, okay?
And then do I mark all four socks? If they don't come up and touch the white on his body, they're true socks.
Yeah, you're only 3.
Well, 3-year-old.
He's got a scar. He's fully scarred over on the left eye. It looks post-trauma. And he has nuts.
Of course he does.
He does have nuts. I see them. Before we sedate him, do you want to walk him around a little bit for us? Is he halter trained?
He's walking around like sort of, and then he just stops.
He's super short-striated on the right hind.
Yeah, he is.
Okay. It's very odd.
Yeah, we could take head radiographs too once he's sedated if you can.
He has like tomcat cheeks. You're very cute. He's got a pretty crusty neck.
We can test him.
I think we should test him.
Okay. It's
Perfect. Good job.
Good boy.
Oh, it's a very good boy.
Good
See, the
boy.
clippers aren't scary.
Yeah.
It's your big fat neck.
Look at all that hair coming off, your coat shedding.
Somebody wants to grab another.
Yeah, I'm gonna chug some water. Hi, sweet boy. Or girl.
Hi, buddy. You got
Hi.
big, soft Labrador
Hi.
eyes.
Your eye hurts, huh? Yeah, we need to stain that eye. You have eye. He has eyes like Flash.
Aw, cute boy. Now over here we've got some little hooves being x-rayed.
Not bearing good weight on it, but he's not very cooperative.
Uh-oh.
Do not get me eaten by a horse.
Did you see anything in there?
Yes, so I see blepharospasm, which is like squinting and excess tearing, and then look at this conjunctiva. Look how red and irritated that is. So that's classic conjunctivitis. I'm gonna get some stain and make sure we don't have a corneal ulcer. But actually, I wanna give him some pain meds before we do that, because his heart rate was normal, but his eye looks really uncomfortable to me. I know, Bubs.
What is that?
So what is that doing?
This is fluorescein stain. This is a special stain that is designed to update abnormalities on the surface of the cornea. And it's made to put into the eye like that. So that seemed mean to put something in a horse's eye.
So if there's stain inside the eye, then there's a hole between the...
Yes, or if there was a neon dot on the surface of the cornea, then we would go, we have a corneal ulcer. I don't actually see any corneal ulcer. But definitely painful and irritated. Yeah. Do we have like neopolybac or anything like that up here? No. Really sweet. Did you see that schmoop?
Ah.
He doesn't have any pain on palpation.
Did you get an age on him?
Yes, he is 22.
22, all right.
You're gonna make me hold him like this because I said something.
He's a good boy. Fullness.
You can't break my glasses.
Yeah, please don't break her glasses.
You're doing those two in the left neck and
Yes,
then maybe in the right?
correct.
This 22-year-old gelding has passed the initial vet exam, and other than his eye, nothing really is serious. I mean, he's skinny, but anyway, he's got all his vaccines, his microchip, deworming's coming right up, and then he's gonna go out in general, or not general population, obviously, but general quarantine for 30 days, and we'll see how he does, and hopefully he's able to go on and get an amazing home.
All right.
So this is B2566. He's a 3-year-old little mini stallion. He had the hallmarks of an equine metabolic horse. So he had like the cresty neck, and he has fat adiposities, and his feet looked kind of concerning. So we took some radiographs, and he does have some rotation in them. But the main thing is, if you look at this view, that pedal bone is very lytic. It has lots of holes in it. It's supposed to look the same opacity all the way through it. And you can see right there at the toe that there is increased cavitation and lucency. So both of his feet look like that. He had more rotation in the right front. But yeah, you can even see on this how there's increased lucencies. So because of that, he's at risk of a fracture in that pedal bone. So based on the significant changes at such a young age, last act of kindness was elected for him.
Dr. Lydia is already on the next horse, and he's got some hair loss over here below his hip, and looks old to me. I don't know. We aged him yet?
Yeah, I don't know how old he is yet.
Yeah. But sometimes they surprise us.
First I called him a girl, and then I called him old.
So let's see.
Very mean. Hi, handsome. You're a very good boy. Oh, you are indeed. Yes, you got the old man nubby tooths. I know. Can I see on this side? It's very embarrassing. You're okay. I need to stand right where you are. Perfect. We're maybe 33.
Aw.
You can see how short these are and smooth, and then these are really long. Have you heard the phrase long in the tooth? Mm-hmm. And your mandible's kind of locked up. Yeah, you're a good boy. You're very beautiful. So you can see the difference between this horse's hair coat that's long and fuzzy, but it's not like big hunks of hair, like that other horse when we were talking about hirsutism. So this to me is like normal old horse winter hair coat. Yeah.
All right, this horse needs to come on out. He doesn't want to come out.
You want to run these two together? Sometimes that's easier.
Well, that black one's been bullying.
Oh, gotcha.
No, he was kicking at him out here.
There you go. Get ready to swing the gate. Give him a little pressure.
Sure. We can work with both of them. Come on. Come on. Come on. Oh, easy. All right, can somebody close that overhead? Oh, easy. Easy. Easy, easy, easy. Don't run over me. All right, Liz, can you get in here and get pictures of these guys? Try to back them up a little bit so we can see them a little bit better. I think he does too. Oh yeah, you know how to back up. You're a good boy. Come on. Good boy. Here. Good. One more tiny step. Good boy. Left hind stop.
You got it?
Yes. Okay. So I'm going to take this. I don't think that needs. He has a little, probably 2 centimeter, very superficial abrasion above his left eye that looks like it happened like today. It does not need to be sutured. Hi, are you scared of this? Vaccines and a microchip. I can get them all done. Good job, sir. You're doing great. I already scanned him. He does not have a chip.
He's so good.
He is a good boy. I would try to clip that little wound by your eyeball, but I think you would hate it.
So you finding anything on him, or how's he doing?
No, he looks great.
How old is he?
He's only 2.5. He's already been castrated, and he's a little concerned and jumpy, but once you get your hands on him, he calms down. He was great for pokes. So I already pulled his blood. His heart and lungs sound good. He has this little gash above his eye that Honestly, it looks like it happened on the way over here. But it doesn't need stitches. I think it'll heal up just fine. His eye is fine. So he's gonna get some vaccines and a microchip and then get turned out to decompress.
That's awesome. Like, he's a youngster.
Yeah.
Hopefully he goes on to find the most amazing home ever.
I hope so too. He's gorgeous.
It's okay, buddy.
Good job. So this little guy is young. He's a gelding. He's a little nervous, but once you get up to him, he's warmed right up to us. His physical exam was completely normal. I didn't get a great listen to his heart and lungs because he's a little nervous and tense today, but heart and lungs, as I could hear, sounded normal. He seems to be sound. He has a little teeny cut above his eye that looks like he might have gotten, honestly, on the trailer or something on the way here, but it doesn't need stitches. He got a microchip and some vaccines, and he's going to be turned out in a quarantine pasture to decompress. He's a really good boy. You guys, I do really like this horse. He's making decent life choices. Does he have shoes on? Guys, he just made some good life choices.
What did he do?
He just didn't flip out and made smart choices. Let's try a DP. Okay, so for this one, Dr. Gina's gonna put the plate underneath. Ooh. You're all right, big girl.
I touched your ears.
A lot of them don't like this.
You can take this off this.
Sure. Just your hand has to be out of the way. Good girl. Might have had some movement. Well, it's a nice oblique view of tooth roots. Let's try it one more time.
Middle and lead don't matter.
It's in the shot though.
I mean, I didn't expect to find anything.
So this horse has a...
I don't see any fractures or anything. Can you see this, Dr. Dina?
And then lips are no control of the lips. And then she breathes in and out, her right through here, it gets sucked in. So Dr. Lydia is very concerned about this horse.
I don't want her to be in respiratory distress. Like, I would love to.
She does have some bleeding there, but I would think if she was going to have any feeling back, it would have happened by now based on the degree of scars in the other areas of her face.
You're a good girl.
She's a good girl.
Okay, the horses are coming out to go to pasture, and they're going to be coming soon. One of them's figuring out he can come. Like, oh, hey, check it out. The last horse is like, wait, whoa, where am I going? Here we go, yay. 25 horses rescued from slaughter today. These horses are not going to Mexico. They're not going to Canada. They're not going to be slaughtered. And we could only have done that because you guys gave money. And I can't thank you enough. I know if the horses could talk, they'd be like, thank you so much, but they can't speak. So I tell you, thank you for them. The ones that are pasture ready, they went out to the quarantine pasture. We've still got some that have to be done tomorrow morning, but they look fine. They're not in, imminent crisis of any kind. And they're still working on a couple more, but I'm gonna have to wrap up. I'm gonna have to get editing. I've got to get this out tonight. And the vets want to do the debriefing. That's what it's called. I'm like, what is it called? Yeah, the veterinary debriefing. They want to do that tonight too. So it's going to be a busy evening. I'm going to get this out as soon as I can. And thank you guys so much for watching. I'm going to go see what Dr. Lydia had to say about today's events.
So our team here at Horse Plus just finished up our first day of intake. We had 25 horses today. We still have 4 more that we didn't get through today, but we were able to go through all but 4 of them. We had some really, really hard and heartbreaking cases. And Dr. Gina and I are about to go down to our office and sit down and do our debriefing video. So if you aren't familiar with what we do, we're gonna sit down and we're gonna go through our notes and our physical exam findings and tell you outcomes on each case so far. The 4 we didn't get to today are a bunch of baby horses and a really adorable baby mule. So they seem to be very stable, and we have to process a ton of blood samples and get a bunch of other things done today. So we focused our efforts on triaging the horses that were in the most pain and discomfort and distress. And hopefully that debriefing video will be available tomorrow, but it'll come out shortly if you're watching and you want to know the outcome of a specific case. Our supporters do name each horses, but our system is to assign them numbers. So it's a bit impersonal if you hear us referring to them as numbers. I promise they'll have names shortly as soon as people vote on those.